This is Radio Health Journal. I'm Nancy Benson. This week, mental health providers are using a gene test to create more individualized treatment for patients.
It can make a big difference in reducing this trial and error or random selection of medication that so many go through.
How a cheek swab is creating more efficient mental health treatment when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
A group of whites ended up dragging him to death behind an automobile right in downtown Tulsa.
The horrific tragedies of the 1921 Tulsa Race Massacre. Then,
there's so much in the world that we couldn't see in any other way except using statistics.
The pros and cons of living in the era of endless information. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
When it comes to diagnosing and treating a patient's mental health, clinicians have to consider many different factors. Things like stress, diet, sleep, even genes can play a role in how a psychological condition might show up. That means, unfortunately, there's no one-size-fits-all approach to treating conditions like depression or anxiety. But what approach is the right one can be anyone's guess.
Until recently, we have not really had good predictors that will tell a clinician the patient may do better on medication A than on medication B.
That's Dr. Mark Pollack, professor of psychiatry and behavioral sciences at Rush University Medical Center and chief medical officer of Myriad Neuroscience. He explains that when treating someone for their mental health, it's not unusual for a patient to be put on 2, 3, or even 4 different medications before they find an effective one.
It's often the case and results in a lot of frustration and distress for the patient who is suffering with depression or other conditions, and obviously can be a challenge for the clinician as well. What often happens, unfortunately, is that there are a series of kind of trial and error attempts to find a medication that works and can be well tolerated.
Although the process is frustrating, Dr. Pollack says it should come as no surprise that different bodies process medications differently. The answer has to do with our metabolism and our genes.
We metabolize medications differently. We process them differently. That's true for lots of things. People are certainly familiar with the idea that some people can eat whatever they want and not gain a pound, and other people eating the same amount of food will have trouble keeping the pounds off. And there's accruing evidence that those differences in metabolism are under the control of our genes.
That's where the GeneSight test developed by Myriad comes in. Clinicians use results from a cheek swab to see, according to our DNA, which treatment options might be best.
Depending on the results of that test, it will provide information to the clinician about which medications the patient should be able to metabolize normally and be able to tolerate reasonably well, and which medications the patient may have trouble with, either metabolizing it too fast so that it gets chewed up quickly and they're tough to maintain an adequate blood level of the medication, so dosage adjustment might be necessary, or metabolizes it very slowly so that blood levels build up very rapidly and the patient may experience intolerable side effects. So it's a guide and a support for the treatment that the clinician can use for the treatment of the patient.
In the 5 years it's been available, the GeneSight test has been used for more than 1 million patients, principally for psychiatric disorders like depression and anxiety. The medications used in these cases are largely broad spectrum, meaning they can be used across a variety of mental health disorders. But Pollack says he views the test as part of a shift toward what he calls precision medicine.
Many patients don't respond either at all or nearly well enough as we would like to the treatments that we have, even to the newer generation of treatments. And as a result, continue to go through cycles of non-response or difficulty tolerating it and multiple trials for treatment that go months and sometimes even years before we find something that works for them. So the individual suffers, and in addition, the system gets overloaded. What the precision medicine or personalized medicine focus is, and increasingly is to try to hone in on individual differences and find medications or other treatments that work for a given individual so that it makes selection of treatment A more rational and more focused for that given individual than treatment of B.
Pollack says with demand for mental health services growing over the past year, largely due to the coronavirus pandemic, that this type of gene testing is even more important.
30 to 40% of Americans are reporting significant stress, anxiety, depression. We're going to be seeing even more demand for mental health services than we have in the past. So the promise of this kind of technology and this kind of testing, the idea of using pharmacogenetics, like the GeneSight test, to get patients on appropriate medication sooner, is something that we improve not just the lives of the individual, but also make the system of care more efficient and allow more people to get treatment.
In the meantime, Pollack and other researchers continue to think about what these tests might look like in the coming years and how they might expand their usage to other disorders.
We're in a constant process of kind of reevaluating the test as more information becomes available in the field in terms of genetic factors that might be relevant for particular disorders or for the treatment of particular disorders. So we're constantly reevaluating the test, deciding how much emphasis to give different genes that are already in it, perhaps to add new ones or other ones. So it's an ongoing process, and the more data and information that we garner in our work and in our testing, and also is available throughout the field of pharmacogenetics, influences how we modify and continue to hone and refine the test.
You can find out more about the GeneSight test and all our guests on our website, radiohealthjournal.org. Our writer this week is Libby Foster. Our studio producer is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
No one is going to go to a restaurant if they think they're going to die. So it really is important that we get the pandemic under control. Otherwise, it'll basically just be wasted money.
How the pandemic has hurt women in the workplace most.
Then, when it comes to hormones, the word doesn't necessarily mean what you may think.
They looked for a word that meant to arouse other glands in the body.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.